I am Hesam Amin. I am a cardiologist in training in the Netherlands, and I'm also involved in the Passion HF project, which is funded by Interact. It stands for Patient Self-Care Using eHealth in Chronic Heart Failure. Next slide, please. These are my disclosures. Next one. So what is heart failure and why to treat it at home? So just in short, heart failure is one of the most important chronic diseases, and it has the treatment of heart failure consists of many different types of medication. And current stage, there are over 3 million people with heart failure in Northwest Europe, and it's estimated that the number will be increasing to more than 5 million by 2025. And this increasing burden on healthcare is unsustainable. So we think that integrating eHealth is vital in order to keep healthcare sustainable, but also keep the quality of care high. And if you look at most of the current heart failure care systems that are available, it still relies on input from the healthcare professionals to provide most care. Next slide, please. So how do we solve this problem? We think that you should involve the healthcare provider that is most motivated, and that is the patient himself. Yeah, next slide, please. Yes. So the patient can be involved in remote care and monitoring if you give them the right tools. With the right tools, also early and targeted intervention is possible, and these interventions are possible as close to the patient as possible, which is at home. And finally, patients with the right tools can perform self-treatment. Next slide, please. So what is Dr. Me? I had sent a link to a short video of 2.5 minutes. I'm not sure if it's possible to play. You are muted.
Is it embedded in the slide, or is it a separate?
No, I had sent it in an email to Luke, but it's okay. I'll just proceed with the presentation. So what is Dr. Me? If you go to the next slide, Dr. Me, we have, so for the problem that I described before, our solution is to create an app which is called Dr. Me. It's an integrated eHealth system which enables true self-care of chronic heart failure. And this also includes self-prescription and self-titration of medications by the patient. And how is this possible? We've created a decision engine with algorithms based on current heart failure guidelines. But we also have integrated self-learning AI algorithms. So we trained a deep learning model based on previous studies in order to also determine, for instance, what patient benefits most from what type of medication. Because heart failure guidelines is just a general guidelines that you just use for all the patients. And Dr. Me also consists of an interactive physician avatar, which is the front end for the patient, and also serious gaming tools are incorporated to stimulate compliance. Next slide, please. So if you look at this graph, at the middle you see there the AI, which says guideline-based algorithms and the artificial intelligence. So you could state that that is the brain of Dr. Me, which consists of guidelines, of the training cohorts, which is used in order to train the AI models, but also data input given by the patient, by the caregivers, the current patient status, clinical status, for instance, lab data, but also data that is available in electronic health records. So all this data is combined, and based on for this decision engine, there is an output which is a treatment advice. And if the advice is low complexity, which means that given the current status of the patient and the given data, the decision engine can make a treatment advice, and it's low complexity, this treatment decision goes directly to the patient without the need for professional caregivers to come in between. However, if the decision engine cannot make a decision, so we call that high complexity, then advice is given to the caregiver, or a caregiver is asked to provide their input, and then the treatment decision goes to the patient. And of course, with this given treatment advice, new data will become available, the outcome of that advice, which is recorded in the electronic health records, show patient data, and there is a feedback loop to the decision engine. Next slide, please. Next one. So now the question. So what are the true innovative aspects of our project? So I think the most innovative part of Dr. Me is we focus on facilitating true self-care. So the patients will treat themselves using the app, and there is no need for a doctor to come in between to, for instance, start new medication, up-titrate medication, or switch to different medication. And we think that this will reduce approximately 70% of patient and physician contact in this, for instance, heart failure setting. And the other innovative aspect of our project is that we translated the guidelines in an application. So I thought that this was quite challenging, because it's not written in the guidelines that if you program this, then you should do it like this. But it is manageable. Next slide, please. So what are the key technological challenges we have faced? Well, as I said, translating the guidelines is manageable but challenging. You need the technical skills and the medical skills to do so. But I think one of the most important things why it is also challenging to program treatment guidelines is that they are incomplete. We don't know everything about medicine yet, and on some parts guidelines are also ambiguous, because we don't know yet which, as I said before, which patient benefits most from what medication. So that was one technological challenge. And the other one, as mentioned before, integration with hospital information systems is difficult, also mainly because hospitals do not just give access to data. At least at our place, it's not readily available yet. Next slide, please. So what measures have we taken to make sure our solution is acceptable and usable? So we have used, as presented before, these BPMN models, which are these flowcharts. If you go to the next slide, then we can see an example. So we have these BPMN models, and in the process of creating these models, we have learned that we need to keep them very small in order to keep flexibility. So because they're small, we call them micro models, and these are translations of the guidelines, but we also have a link and integration with the machine learning part. So next slide, please. So what other measures have we taken? Yeah, so these BPMN models have been used before, so we know it's acceptable and usable for technicians and clinicians. And we are right now doing synthetic testing and testing our decision engine with use of real-life data retrospectively to see if mainly if there are no bugs and if all outcomes, medical outcomes, are correct. Next slide, please. What evidence have we collected to date? So, as I mentioned before, we are still in the process of running these simulations, and we are also involved in a pilot study which uses live data of patients, which will start in the next few months. But our preliminary results of our synthetic testing is that the outcomes of the medical decision models are as expected. Next slide, please. So how can we integrate our solution with the current practice? So one thing which makes our solution, which sounds very well to me also futuristic, because there is still a great distance to bridge between the present and true integration in, for instance, hospital information systems. Because for our system, we need the all medical data in order to create a safe therapy advice. We need live, for instance, lab data in order to make medical decisions regarding which medication is safe to up-titrate. So because that is not available today, we still think we can use our solution, but as a decision support at this current stage. So if you use it as a decision support, then the healthcare professional, well, at this stage, has to put in some manual variables, which he or she can recover from the hospital information system. But the advice which is presented by the decision engine is the responsibility of the healthcare professional to choose if that is the way to go or not. So in this, if you use the system in this way, then I think you can implement it today or tomorrow, and also give heart failure expert level care, for instance, at general practitioners. Next slide, please. So how can our solution integrate itself with other platforms? So we have developed our platform, of course, to be ready for connections to other platforms with a communication layer and with APIs. And also our goal is to be fair and or HL7 compliant. And I think this was the last slide. Next one, please. Yes, that was it. So thank you for your attention.